For the advanced clinical training for the veterinarians, which is usually done on the second day of training, what we'll do is we'll go through radiography interpretation. It doesn't do any good to have a dental x-ray unit if it sits against the wall and you never use it. So we need to learn how to interpret radiographs so we can properly treat our patients. We'll go through periodontal surgery, so we know what closed root planing, open root planing, how to place a bone graft, how to use periosutic material. We'll talk about pain management in oral surgery and how to use regional nerve blocks whenever we do anything that's painful for our patients. We're going to emphasize and spend the most time probably on performing oral surgery, from creation of a mucogingival flap to removal of buccal bone to sectioning the tooth to proper techniques to elevate and extract the tooth, release the periosteum and close the flap. The goal at the end of the advanced clinical training session is for you as a veterinarian to understand and be able to properly diagnose oral disease and treat oral disease in probably 95% of the patients that walk through your front door. For your technicians, we're going to provide a full day of training. A veterinary technician specialist will come to your hospital and train your staff at your hospital with your equipment. It's our goal to make the technicians part of your team. And so in an ideal environment, what we want to do is have the technicians do the supragingival, subgingival scaling and polishing. They probe, they chart, they take full mouth radiographs of every patient. They're going to hand you as the veterinarian the dental chart and the radiographs. You're going to diagnose and treat. But the technicians never leave our side because we're pretty helpless without them. So as part of their clinical training for the day, the veterinary technician specialist is going to teach the technicians how to do supragingival and subgingival scaling and polishing, how to probe around each tooth, how to complete the dentistry chart, and how to take full mouth radiographs for every single patient in a timely and efficient manner. Our goal at the end of the day is to have your technicians all comfortable with the standard of care that you're going to provide your patients so that they can be part of your team and give you the information that you need to properly diagnose and treat your patients.